Got this.
Hi, how are you? This is Damaris Maria Grossman, Doctor of Nurse Practice and the Integrative Family Nurse Practitioner. This is the Mindfully Integrative Show. And today we have a mindful chat with Ellie Weinstein. He is an amazing, the dude therapist, and he has so much to share with you about his integrative practice and how he shares his knowledge and helps others. Nice to meet you today, Ellie.
Thank you so much for
Is it Ellie
rescheduling,
or
moving.
Eli?
Ellie, it's
You
Ellie.
said Ellie,
So
right? Yeah.
I know. So my long, I have a, I'm Jewish, so I have a Hebrew name that is very long that most human beings cannot pronounce, unless you know and see it spelled in Hebrew and you know how to read Hebrew. But my nickname is Eli, so that can be interchanged as Eli or Ellie. But I've always been called Ellie, and if someone ends up calling me Eli, that's okay too. I don't get offended. It's fine.
Gotcha. That's cool. I like it.
Hi
So I
everyone.
always start by saying like what's kind of like a small fun fact about you or things that people don't know about you that they
When I was a kid, I was in a boys' choir that traveled around the world.
wow, that's so cool.
Yeah, it was really fun. I was in it for like 4 years. Um, I don't know if it means I can still sing, but I used to be able to sing as a kid. And of course, voice changed, and then my voice went to kind of
That's fun.
different level.
So how what would you like to share on this podcast about, you as a therapist, but kind of like where you kind of came about to where you are now and how it kind of transformed your from traditional to like an integrative health practice or just in general, how your story.
Well, we could be here for hours on my story.
Or,
Uh,
what you would like to share.
For sure. So as a kid, I really struggled with ADHD and social cues, behavioral issues, just a lot of struggles that you can imagine someone who had the classic sense of ADHD, of hyperactivity. And I struggled in school and struggled to make friends. And over the years of therapy, hard work, it got me so interested in the mental health world that I am in now today. And through that, became, I believe, one of the, and I don't like saying that ADHD is a superpower because it is a struggle and I don't want to dismiss people who struggle with ADHD, but through my journey of ADHD, it has taught me skills that I might not have had without ADHD opening that door for me. So for me now, it's extreme because of the hard work that I had to do. I'm very compassionate, very empathetic, and I'm very observant and perceptive. Um, and now I'm a social butterfly because I've utilized the skills of having the energy and I've learned how to kind of use them to my advantage for people. And when I finally put all those puzzles and pieces of the puzzle together,
Mhm.
I knew I had to be a therapist. I knew,
Gotcha.
like, it's something that I know is me.
Mhm.
And for me, the integrative part is learning that who I am is not a negative or a detriment to my practice, but makes it a positive. That being a parent, going through IVF with my wife, being married, having ADHD, having postpartum anxiety when I had my daughter,
Mhm.
all these things, and I share a lot of it on social media, whether it's on the
Talking
Dude
about that even
Therapist
as a
podcast,
father.
as
I
a
wish more and
father.
more men would talk about that. My husband and I were just having a conversation. Not to cut you off, my husband and I were just having a conversation. He's like, men don't talk about the postpartum guy stuff.
Tell him talk to me. And I actually collaborated with an amazing doctor named Dr. Cassidy Freitas, who her specialty and dissertation in grad school was men's postpartum symptoms. And
Amazing. Oh,
it's
that's
legitimate.
awesome.
It's like
No,
legitimate.
really.
It's
I
totally
totally
legitimate,
agree.
right? And so all these things together, and when I was looking at social media and I was looking at older therapists, the thing that I struggle with is you're so removed, you're so pulled back, you're not being who you are, you're being what you think the world needs a therapist to be, or what a client wants this perfection being, this above and beyond gold standard of human being to be your therapist. And in
Mhm.
reality, I think what connects with my clients the most is that I'm a person and I'm human. So, before we got on, I said that, we had a nice blowout with my daughter this morning. She was overwhelmed, throwing a massive tantrum, and I was in a bad headspace after calming her down and getting her out the door. And it happened to be because she was in a bad headspace and she couldn't calm herself down. I had to cancel my first client. You know what my client said to me when I said, yeah, I'm having some struggles with childcare, and my daughter this morning, she's not doing so great. That's do the best you can. Thanks so much for being so honest. Speak to you next week. Not what? You're you're a human? Um,
I was glad you told me because I'm just telling you how I was like my little one. I mean, it's common, but I feel like we're all trying to be perfect and it's kind of frustrating sometimes, you know?
and the more, and this is your whole thing of mindfulness, what truly mindfulness is in being present in what you're feeling, how you're feeling, when you're feeling it now.
Right.
Not fitting into a box of what we should or have to be feeling or need to be doing. It doesn't mean we're hiding from our feelings. It doesn't mean we're pushing ourselves away and being and putting on some sense of a mask. But in reality, being present is, hey, I struggled today, but it doesn't mean my whole day is shot. Or
Right.
I have parts of me that are bad or good or ugly or not so great. It doesn't mean I'm a bad person or that, something is bad. And I hate using that word good or bad, but that we can be all of ourselves and still be okay. And
Right.
being mindful and present with that and savoring what shows up that day, how it shows up. We might not like it, we might not enjoy it all the time, but it is who we are.
I couldn't agree more. How
I don't know if I
how
answered your question, by the way, but
no, no, it's not the full, I just was coming back to your story. Let's go back into that.
of ADHD.
And just how you are with your clients now.
So, my biggest thing with my clients is that I try to show up and meet them where they're at every day. So, I'm currently uh, training an intern. I'm a supervisor at a clinic. And the funny thing is that when you're an intern and you're in grad school, you're pushed to have a plan and a perfect treatment from, let's say, CBT, DBT, ACT, every letter of the alphabet for therapy. It has to be like this regimented thing. And I don't think that way.
Mm-hmm.
So for me, my practice is very much okay, I might take some here, put some there. But if you show up differently than what fits into the regiment agenda of what your treatment is that day, I'm going to show up that way for you. So
Right.
I specialize, I'm a relationship specialist. I just started calling myself that. Not an expert, but a specialist. And I had a couple who's like, oh, we're not dealing with relationship stuff. I'm like, but you are bringing that into the session today. Something is on your mind, right?
Yeah.
So I have to integrate my personality, who I am, my mindfulness of being present with
Yeah.
that client. Yeah, we'll get to the agenda tomorrow. Don't worry, I have it in my notes. I have it in my electronic health system. I have a little thing for myself that we're going to talk about that at some point. But my clients, all about what are you feeling today? What's going on today? Yes, you might have this diagnosis, you might have that diagnosis, this issue you're coming to therapy or that issue. But if something's coming, and if you work with me, you'll hear me say this often. If you're bringing it out, it means your heart and mind is telling you it's important to do it. So let's not dismiss it. Let's embrace it and let's go with it for that day.
That's so important. You're really kind of trying to getting and tapping into like what their center thoughts are at that time instead of just going, this was the topic. They might not even realize they needed the help in it.
Exactly. So if someone comes to me with an issue that they're struggling with, let's say with anxiety or depression, we'll just take the basic foundations of mental health things. And that week, something is coming up with family boundaries and the holidays. That doesn't have to do with depression. What are we talking about this? Excuse me, client. Let's get back on track. What are you doing here? I would never say that. That's not what healthy therapy is. Yes, I might have a thought process of CBT and how to go through it and what the steps are and where we have to kind of check off to become and go towards a goal. But if my client doesn't fit in that box that day, what am I going to do? Force them? That's not healthy. Let's be
No.
mindful and present in how they show up that day. So let's talk about family boundaries and holidays today. And we'll get to the other stuff later.
I feel like a lot of parents don't, or when these patients, if you tell them to fit in that box, they'll probably be like, great, this is what my therapy was.
But the funny thing is that if you go to I'm not here to bash any of this, but if you go to, let's say, to a DBT clinic or an ACT or CBT program or clinic, You're getting a programmed agenda of what that therapy is. And if you need it, great. If it helps you, awesome. If you need regimented, scheduled progress reports and treatment plans and focused weekly agendas and checklists that this week we're going to do that, next week we're going to do that, and the week we're going to do that, then good, go for it. Get that. Do it. I love that. I can't do that. That's not my style.
Hmm.
And I have some friends of mine and colleagues that fit into that style of therapy. And if you need that, find it. It's there. But if you don't, that's okay too, because that's there as well.
So kind of what you're saying is you integrate all of your therapies in a way that fits the client, and you don't just have a very regimented way, but you use all of the components.
Yeah, I will add this caveat. I am more of a CBT, cognitive behavioral therapy leaning thought process and lens of my focus. It's just how I just like that mentality. I love the research. I like the Aaron Beck, who recently passed away. I like that perspective. But I love DBT. I'm just not confident yet enough with myself as a therapist
Hmm.
to say that I throw that in there often enough. I
Gotcha.
dabble. And I'm getting more into ACT, acceptance commitment therapy, and I'm starting to as a couples therapist. I balance Gottman Institute and emotionally focused therapy, Dr. Sue Johnson, and those kind of thought process as well. And if let's say I just did CBT and someone doesn't fit into that box, well, am I not going to work with them if they need help?
Yeah.
Right? That doesn't bode well with me as a therapist trying to help people. Because if they don't fit into my box as a therapist, then you're not good enough for my program. I don't like that. I'm not a program. I'm a person and a therapist who's trying to help you with what you're coming to the table with that day.
That
So,
makes sense.
and sometimes it's hard to intellectualize or put on paper exactly what I'm doing. But if I take a step back and I see the long term of my treatment with a client, I can see the goals that we've accomplished based on the progress they make on a week to week basis or a month to month basis versus a program I have pushed them into
No, I like that. I
or squeezed them
appreciate that
into.
more because you're being more real and honest with them.
Yeah, hopefully it works. People come back every week, so I mean, if they really hated it, they wouldn't show it. Not that I'm this amazing therapist, but if they didn't want to come to my therapy, they would say, "Sorry, Ellie, I'm gonna find someone else." So I guess it works for some people.
So, would you like to share, I don't necessarily clients or, but someone that you obviously are talking about people that have inspired you to where,
Are you talking about family or professors or?
I mean, you can share either one or both.
Sure. So I'm a big fan of learning from my elders and people who've done it before me. Um, and I would say that I had about, so I went to Fordham University for grad school.
Mm-hmm.
Not every professor was clinical. And I would really shout out a few professors that I've had over the years and one supervisor that truly shaped me in my thought process of what I believe in as good therapy. Hopefully it is. The first person is Dr. Alan Perry. Not related to Dr. Bruce Perry, but Dr. Alan Perry in Touro College. I had him in undergrad in psychology. And his perspective that really opened my mind to what a therapist should be doing
Mm-hmm.
is seeing a person as a person. Now, their diagnosis helps maybe guide treatment, help with billing, insurance, maybe medication management, of course, right?
Mm-hmm.
Because if someone has schizophrenia versus anxiety, it's two different medications. You're not going to push one versus the other. You need to know that and have a real diagnosis for the medical treatment side of mental health. But for the therapy mental health side of treatment, he would really go through and help listening and seeing beyond that title and beyond the words they're saying and how they smell, feel, look, all the senses in the room, all the senses now through video, whatever it is, to see the person as a person, what they're truly trying to say, and what they're struggling and what the pain and what the emotions are. And he really kind of opened my eyes to what a therapist can do. And I adore him, and he's hilarious and so inappropriate. It was so funny as a student, just lightening the mood on such a serious topic, and really was very important for me. I also had another professor, Dr. Koch, in Fordham, who his energy and the love and the compassion that he had for his clients, that taught me a layer of what it means to be compassionate and be with a person as a human on your side as a therapist.
Hmm.
And he was this very over the top energy kind of personality. I'm sure he won't hear this, but I loved how he showed up to class every day, or whatever it was, twice a whatever, how many classes we had
Yeah.
with him. And the last person really is Dr. Stanley Rustin, and he worked with Aaron Beck and Dr. Viktor Frankl, and he was like this old school thought process who's gone through the therapy world for the past 60 years, and
Wow,
seeing the
that's so many
progress
years.
of him and how he's practiced, when he's practiced, how he had to change as a therapist with the times was very inspiring, and just very his old school thought process was what's best for the client. I don't care about all the other garbage. I'm going to show up for the client.
Hmm.
And that was a very like stick it to it, all the external garbage that goes on in the world and all the extra, but like I'm going to be here. And
I
so
think
many other
that's so
yeah.
important.
Yeah, so those three, um and now that I'm saying that, I really have only had a lot of. It's funny because in the world of mental health, it's very female oriented, and I just mentioned three men. But
Okay.
for me, it was like a very beautiful thing to see men in the therapy world that I didn't get to see as a student and as an intern, and even now as a professional, private practice, um, and on social media. Having that male perspective for me as a male going into the world of mental health was super important to see that you can do it and be successful and actually be a feeling, emotional, vulnerable human being as a therapist and still do great work.
That's a whole other touch subject that you're talking about, being you know, having the male perspective on things and a therapist. I think hopefully listeners or people hearing you not only will see you as a relationship specialist, but trying to also humanize the man's point of view, and making it okay to be vulnerable. Because I think that the men are always trying to be tough on every little aspect, and I literally, like I was telling you with my toddler, I think kids definitely weigh in what a man or women or the whatever the social party you have or your partner, whoever it is, makes you like have that vulnerability. And I think that's good that you're sharing that, because I think someone needs to hear it, because it's okay to not always have the right answer, or to
Yeah.
be there and be like, hey, we've had a bad day.
And I will say, Secret Time. I really haven't told a lot of people about this, but it's on my heart, it's on my mind, so I might as well. I just started writing, just literally pebbles, small little ideas onto a Word document for a book about manhood. Just
Awesome.
little bit.
See. So you see my mindfulness, how I'm always about like the present and the thoughts. I go in with where energy flows and where things and thoughts that kind of came with me as I was talking with you. I think that you have a good perspective that men need to hear.
I appreciate that. So someone's been pushing me to write a book, and like I was telling you before, I get overwhelmed with doing too much, and the idea of
It is
write
tough because I'm trying to write myself. So, and then
it's not my
I'm
thing.
even trying to get a collaborative book together of this podcast. So
It's not
I get it.
writing's not my strong suit in life. It really isn't. Speaking and working with human beings face to face or interacting with people, that's my strong suit. So writing is not my really not my forte. I know that it's always been a struggle of mine. Grammar, collecting thoughts into an organized way because of my ADHD. I just like word vomit on a thing.
Totally. Me
My wife
too.
is my editor. She'll be like, let's just. She has my access to my social media, and she goes in. She's like, let's just change this grammar.
So my
Um,
positive and my little tip for you is voice text and get an editor. I always edit, have editors.
well, I literally just started last week, just sitting while my wife is watching Dancing with the Stars or Survivor or Bachelor or Bachelorette, and I'm in the room with her and I'm just spending time with her. Then instead of just spacing out and scrolling through my phone for 30 minutes to an hour, just spend 10 20 minutes just writing something, just writing thoughts. There's no pressure. I'm not putting out a book anytime soon, but just that idea of just
I totally recommend. Literally put a headphone on and I will voice text. All platforms allow it, and it's very helpful. And you can just literally vomit your words on there and outline, and it helps.
amazing. Good to know.
So let's share more with the listeners a little bit. Maybe do you have a story that you could, without obviously being with privacy with client, that you'd like
Mhm.
to share, or family, or something that kind of came to you recently that was important?
Yeah. So something that's been on my mind recently is the idea of boundaries. And I think so often we are very scared to set those boundaries because of who it might affect, when in reality, we're trying to make it better for ourselves. And I was working with someone in the past couple of weeks, and um, she said something to me that was very impactful. She said, my family's having a hard time with me being better, with me being good, with me being healthier, because they're like, who is this new person? We're used to old so and so. Now I call all my clients Bob. I don't have any clients named Bob. So I said, who is this new Bob? Right? I like the old Bob was a people pleaser. The old Bob let me do X, Y, and Z. The old Bob got let me get away with that. The old Bob always said yes. The old Bob, and it's funny because me myself as a people pleaser, I really connected to that statement. How the hard work of setting boundaries is that sometimes, now this is really ACT thought process, is that you're committing and accepting the life that you have and changing and working through it, and you have to also accept with the repercussions of other people not liking it. So when I'm working with this client on boundaries, the thing I constantly say is that they don't have to like it, but you need to remind yourself that you're not doing this in the sense of hatred and malice. You're not setting a boundary to be a butt face. I'm not going to curse on here. To be a
Mm-hmm.
butt face or to be annoying or mean. You're doing it because you need it for your health. You need it for your mental stability and your sanity. And if someone can't accept that right now, then they cannot be in your life for that. It doesn't mean you dismiss them or excommunicate them or push them away, but it's okay to subtract a little bit right now for the time being and help them understand, help them explain, show this new reality, show them who you are and what is working for you and what needs to happen for you. And too often, we push aside our boundaries in the sense of guilt and shame of others, and feeling upset or that we're hurting other people. And when we're constantly putting others instead of ourselves, um, we get lost in the shuffle, and that's a really hard place to be when you're married or in a long-term relationship, when you have a family, when you have kids, when you have a job. When Where do you fit in? Right? It's too hard. You get lost in the 80 things that you're doing, and sometimes it means just making that small boundary. We're not talking about big boundaries here. We're not trying to make massive changes to really mess with the equilibrium of your life.
Mm-hmm.
But little bits here and there to create little fences and little boundaries can really make the difference of you feeling a sense of control, a sense of validation and fulfillment, but at the same time, not rocking the boat too much, but making sure that your core people are in on the core values that you're changing and in on the plan because you want them included, you want them to be around. So that's just something that's been going on recently with a few of my clients, especially with the holidays coming up and everything going on in
I can
life.
imagine. I mean, everybody wants to have their space, but also still see family without like being in the way. And then everybody has the certain things that they want and do. And I can only imagine how. And that's another part where you have to be like, it's okay to have the boundary, right? And telling these people that it's okay to say no,
Yeah.
or not always agree with everything that people want.
Like even if we just take, not to get into a hot topic or political or anything like that, but
Yeah, no, no, yeah.
like
Not
COVID, for example, it causes a lot of stressors for a lot of people.
yeah.
And
I'm for the most part don't talk about it, but yeah, yeah, it
yeah,
was.
right. But like, what if someone doesn't agree with your viewpoints and they're coming to your house? Do you set that boundary? Do you say, okay, so maybe you did or didn't get the vaccine, mask or no mask? You have to do what's your core value of what you believe in for your health and safety and sanity.
Right.
And that might push buttons and push away people, but it doesn't mean you're not doing it with love and concern. It's how you say it, when you say it, and how you explain yourself, and where you're coming with compassion and empathy for the other person, and make sure that it also comes into the compassion of yourself.
That's really important. I mean, in any topic, because I think
Any
that,
topic.
yeah, because I think people have to be really truthful to themselves and the other person. I like, so I'm glad that you've been on the show. I mean, is there more that you'd like to share, like a little tip right before you go, before I, have you off or anything? And I will have in the show notes a ways for people to get a hold of you. But first, before you go?
Yeah, just a quick tip I always say is that I think we need to be more compassionate and loving to ourselves as often as we can. Like I said this morning, my daughter had a massive tantrum, and the first thing I did was beat myself up because I wasn't being a good enough parent, even though I was doing the best that I could. And I did nothing wrong, right? I didn't do anything wrong. But in reality, I think when we start doing that too often, we get into a very headspace, a negative headspace about every little aspect that we're living our lives. We can't do this right. We're not doing that right. I suck at this. I suck at that. And I think if we start just adding and not this fluffy, lovey dovey mantra, and if you want to have a mantra, go for it. I love that stuff if it works for you. But for me, it's not this idea that you have to say something, but when you feel a sense of love and compassion, make sure you add that into your thought process. Make sure you start saying those things a little bit more than the negative. Because according to Dr. Rick Hansen and all this research on you can actually, with neuroplasticity, recreate mindsets,
Yes.
neural
Oh my God, I
pathways.
read about it all the time.
Like literally, you actually as a human being have the power to change your brain structure with neuroplasticity
Positivity.
for the negative and for the positive. So the more you talk about yourself in a negative light, the more you think negatively, the more it actually does impact the neuroplasticity of your brain and create neural pathways the highways basically of a behavior to a thought to a feeling and to an action.
I
So
love that.
add the
Uh,
love, add the compassion to yourself, and of course, make sure you're being real about it, not fake. Believe it.
I love that you say like not just putting a mantra because I talk about mantras as repetitive conversation, but I love what you're saying. It's more of like the truth bomb. Today I had a bad day, but I am good enough, and I
Yes.
think that truth of instead of not I'm just happy, like don't just say like where are you at and be real with the today moment. I think that's very
Love it.
profound and really necessary because we sometimes are like, yeah, just say I'm happy that or say it's a good day and we
Manifest
don't
it.
always
Just
right. It
manifest it.
manifests. It doesn't just magically happen, right?
I'm not a big
but
fan of that word
but
that people
keeping a
overuse.
positive mindset in and redirecting the words.
I love that. I think that's a great way to end. That's awesome.
Yeah.
You did it.
Hey,
Drop that
thank
mic.
you so much for being on the show, on this Mindfully Integrative show. And I will have all of your information in the show notes. Is there one email or some contact that you want me to reach out? Because I know you're the dude therapist. So I bet if everybody looks you up, they should find you. But you're also a relationship specialist. So not just the dude
Yeah,
specialist.
so just to clarify, my name, the Dude Therapist, is just because I'm a dude who's a therapist,
but
which is a
it
catchy name for
fits.
my podcast. But I work with everyone and anyone. And my website, which has all my contact information, my speaking engagement opportunities, all the services that I provide, is www.ellieweinstein.lcsw.com. So you can contact me through there. My Instagram links are on there. My phone number, my email, everything's on that website.
Awesome. Well, I really appreciate it. Your time and your all of your wonderful knowledge. So I can't wait for those to reach out to you. Thanks again.
Thanks so much.